guys, welcome to Chit Chat with CYC. Today is our second podcast, which will talk about mental health, and our special guest for today is Joel. Here, he will help us to answer all of the common questions about the mental health. Hello, Joel. Thank you for joining us today. Can you introduce yourself a bit to our viewers?
Hi Hannah, thanks for having me today. I'm Joel. I am an NLP practitioner and I'm also a hypnotherapist certified by the American Board of Hypnotherapy. What would you like to ask me today?
Okay, so let's start to the topic, which is about the mental health. Can you explain a bit about what is mental health and what cause of the mental health itself?
Mental health actually is one of the most relevant issues in the modern times, right? It affects many people, especially for the younger generations. They come with a symptom, right? So what are the symptoms? Symptoms are differing from person to person. Some people might feel low, they might feel down. Some people might feel worthless, no hope, and some people might not have enough sleep or too much sleep. Right? Especially this pandemic, everyone's sleeping a lot, right? Not eating properly, and some people are withdrawn from society, not communicating with their family and friends, right? To a certain effect, some people feel so worthless, right? They just want to commit suicide or even injuring themselves. So the cases, right, are escalating in these modern times. And why is this happening? They're all triggered through life events, right? Or a combination or a few, right? What are life events? Right? For example, you can see people losing job. Again, very evident during these times, right? Pandemic, losing a job, right? It's relevant, right? Everybody's looking for a job now. Relationship problems, right? For example, especially for those who can't see your boyfriend, girlfriend, or those husband and wife, right, are interstate. The government does not allow you to travel, right? So if you don't meet your partner, right, you don't have communication, it really affects your relationship. Right? And what do you do during the pandemic? You stay at home, you stay in your condo apartment, you just watch movie, Korean drama, K-drama, all right, eating and sleeping, and right, it really affects yourself. When you see your mirror, oh my goodness me, I'm putting on weight. You feel very down, very negative. So these are some of the examples, right? It sounds humorous, but it's true. Some people take it very differently. So it differs from case to case, person to person.
Even like I have friends from Indonesia, right? Same with me. She stayed with me like from March in KL until now, but sadly because of the pandemic, she cannot get job, and then she feels like every day just like wake up, watching drama, and then go to sleep, and don't have anyone to talk because everyone is busy with themselves. So she feels like really down nowadays and decide to going back.
Yeah, these are true events, and we can see some of my friends also are going through it.
Also, I have boyfriend, right? And my boyfriend actually only like 18 kilometers far from me, but I cannot see him, so it feels like I get depressed sometimes.
Yeah, please keep a safe distance and follow the SOP.
Yes, okay. And then if with someone like that, right? Like my housemate and also my boyfriend, if they have like depression, how can I speak to them if I really want to help them?
Okay, there are 6 points here I'd like to highlight, right? Number one is you need to encourage them to seek help. Now, people with anxiety and depression, right, all right, they don't want to tell anyone, all right? They like to keep it to themselves, and they don't know how to express, right? They felt that mental health is something different from physical health problem. Encourage them to seek help, to seek professional help. And you don't be afraid to bring it up to them. Yes, they are your kawan-kawan and they are your friends, right? But you need to tell them, you have an issue, my friend, you need to seek help. And don't blame them in your conversation. Because they don't talk to you, just because they say a wrong thing, and they go through difficult moments in life, don't blame them, right? Be supportive, be encouraging, and be patient with them, right? Patience goes a long way, right? And to have patience, you need to have understanding. And the final point I want to say is, right, you need to look after yourself before you even look and talk to your friend that has a mental problem, right? It's like depression, anxiety. You need to mentally be ready. You need to take care of yourself, right, so that you can talk to them. And that's very important. Okay, if not means, right, you feel down also. You feel, why my friend say like that? Why my friend don't answer me, don't talk to me? be understanding, be patient, be encouraging, and don't blame them. That's what I would advise you and anyone who is listening.
Okay, then I will try to talk with my housemate. So, really, thank you for the nice suggestion.
Welcome.
Yeah. And then, have you ever heard about PTSD?
Yes, post-traumatic stress disorder. Usually a person that has this kind of symptom, right, they go through a traumatic event. And this is part of the psychological symptoms that people will have. Traumatic events. I give you a good example, right? People, veteran war heroes, they go to war, they kill a lot of people. When they come back, they don't understand or can live back to normal society. They have gone to a battle, their mindset have changed, they just can't adapt, and people don't understand. Okay? So example I give you, the old movies, right? It's like Rainbow. If you read through Rainbow, the guy went to war, veteran war, came back. He was a very quiet person. He don't want to talk to anybody. He kept everything to himself, but he had issues, right? Once they trigger that traumatic event, he changed, he flipped, he thought he was going to war, right? In a normal society, maybe it's a car accident, maybe abusive relationship, So these kind of things, right, in a very traumatic event, right, really can trigger you, and it actually differs from a person to person. For somebody, you say, this is very simple, nothing wrong with, but for them, it's very, very traumatic. So you cannot judge, right, and it differs for a person. And this symptom don't straight away come out, right? It takes time, and then it keeps developing, it keeps piling up, and then one time, boom, it come out, right? Wow, everything changed. And 10% of the population will experience it time to time. And people like that, they really need treatment, right? So you need to look for a professional to seek help to recover from PTSD.
So the PTSD person can heal, right?
Can. You need help lah, right? Help.
Yeah, understand. But then, how about the other mental health condition? Because we not only talk about the PTSD. So, about others' mental health problem, is there any drugs or therapies that can help them to getting better?
So for sure, you take medication lor, right? You can take medication like antidepressant, right? It can help you lah, but to certain extent, and it's not for everyone. There are other therapies you can take, alternatives, like therapies, counseling, or a combination of anyone, even with drugs, right? Medication. You can also go for CBT, cognitive behavior therapy, right? You can also go for hypnotherapy, right? That is looking at the subconscious mind, addressing traumatic issues and resolving it. You need to find help. You need to find professional, right, to really address this issue. You cannot leave it hanging. You understand? So this is serious. We joke about it, but it's a serious thing. You cannot just let it go like that.
Yeah. But then, right, the therapies and medication is like a bit costly. So, is there any way for the viewers, if they don't really have budget to do that?
I think they really need to seek help first. Why don't you? They can always always can look for a professional, right? And I'm sure the first consultancy fee is not very expensive, right? You can go to government hospital. Government hospital is not very expensive. It's just few ringgit to go and meet a doctor. But at the end, right, seek professional help because they need it.
Okay, then thank you so much for the really nice tips. I will use that for all of my friends, all of my relatives that maybe have mental health problems nowadays.
Yep, sure.
Okay, so that's all for today, Chit Chat for CYC. I hope you guys can enjoy it and stay tuned. There will be another interesting topic ahead.